Okay, so that makes sense. And how often do they come back to the physician?
Yep, absolutely. So the patient comes back in 2 weeks after the initial setup, and the 2 weeks is more of just to check up on things, make sure they're using the device, making sure they don't have any questions or that they're comfortable with it. And then secondarily, at that point, you will plug the device in and you will increase their stimulation level because they won't come back in for another 4 weeks. So increasing the stim level allows the pelvic floor to get a good workout, and then once it achieves a certain goal, you increase the stimulation level so it does not plateau.
That certainly makes sense as well.
So they'll come back in they'll come back in at the 2 week mark, and then it's a 6 week, 10 week, and 14 week checkup. If they have stress incontinence at the 14 weeks, they're pretty much dry. If they have urge and mixed incontinence, the protocol is a bit longer, and it's actually twice as long for urge and mixed as it is for stress.
Okay. And what about maintenance?
Yeah, certainly. So what's wonderful about Intone, and again, very unique to this product, is that the patient owns the device. So they get to continue with their pelvic health in the privacy of their own home. And once they've achieved continence, in order to maintain that pelvic health, they just use Intone once or twice a week, and they will keep their symptoms at bay.
A little bit different than some of the other things that have been out there. That's good news.
Absolutely.
Okay, a few other questions that come to mind for me. Clinician-wise, can any clinician prescribe this? Any prescribing clinician? Or can it be APRN? Can it be...
Sure. Any medical professional that has the ability to write a prescription can write a prescription for Intone.
Okay, and currently, where are you seeing this? Is it mostly at gynecologists?
Oh, that's a great question. So we're seeing it all across the board. It's really being adopted universally by many obstetrics and gynecology offices. The urogynecologists and also the urologists do utilize this as well. And we also have seen that some pelvic floor physical therapists have started to incorporate this into their practices as well.
Okay, great. How about someone who has maybe undergone other treatments? Let's say someone's had a sling and that hasn't worked out, or someone's already tried medications, or someone's been through pelvic floor physical therapy and has not had great results. Talk to me about those kinds of patients.
Sure. Well, we know that there are many different continence therapies out there. Anything from pharmacological options, such as an anticholinergic to help with overactive bladder, to sling surgery to basically help with stress incontinence. So any of those patients, if they have had surgery and that surgery has not gotten them dry, they can use Intone and achieve continence. For any patient that is on an anticholinergic and they're experiencing several side effects to those anticholinergics, negative side effects, they could discontinue use of their anticholinergic and actually use Intone. Over time, Intone will work to calm the overactive bladder and has no negative side effects. There are also other therapies available, whether they're surgical options or not, some to treat overactive bladder, such as Interstim or Botox. And with regards to Interstim, that's an implantable device, so it is a surgical procedure that you live with for the rest of your life. Or with Botox, you actually have to come back in for reoccurring injections into the bladder wall every basically 6 to 10 months to keep your symptoms at bay.
So this seems like a possible alternative.
Well, it's a great conservative therapy that you can try in place of any of those other therapies and see if it would work for that patient. And if not, then you could choose a more aggressive approach.
Okay, fair enough. What about the patient who maybe is a bit more complicated? Let's say we've got a patient with MS. Let's say we've got an oncology patient. Sure. Let's say we have a patient with prolapse. Yeah. What about these kinds of situations?
Great question. So there is actually some documented literature out there that does show that pelvic floor muscle rehabilitation will in fact improve prolapse. So if a patient has a grade 1 or 2 prolapse and they're really averse to surgery, you could utilize Intone to strengthen the pelvic floor and certainly at a minimum, ensure that prolapse doesn't become a grade 3 or 4 and need surgery. Secondarily, I would say that for the MS patient population, those are typically the patients that would have InterStim or Botox, and while Intone will not treat the underlying neurologic issue, it will help with their incontinence episodes.
Okay. Oncology?
I'm not exactly sure on that one, Barb. Gotta be
Okay.
honest with you.
All right.
When you say oncology, you're
I actually had that
referencing,
question asked me over the weekend.
what are we
Yeah.
referencing in oncology?
There was a woman that came by that asked about uterine cancer, and she had
No active cancer patient
okay.
can utilize this. Now, if they're not an active cancer patient, they might be able to, but I would
Well,
worry.
let's go back to that. Yeah, that would be great if you got one. So let's go back to that in a more formal kind of way, because why don't you say that an active cancer patient cannot? Is that, or do you not want to put that on tape?
No, I absolutely do.
Okay.
I absolutely do.
So what about an oncology patient?
Sure, certainly. So if they're an active cancer patient that is being treated, Intone would not be utilized for that particular patient. Now, if they have undergone their treatment and completed it, and they have urinary incontinence, certainly they could look into Intone to treat their urinary incontinence symptoms.
Okay, all right. And in the same vein, how about postpartum women who have had maybe complications from vaginal childbirth?
Sure. Well, actually, many of those patients, after they've delivered a baby, 6 weeks later, they are still incontinent. And Intone is a perfect solution for those patients, as typically after the vaginal delivery, the patient is very stretched out, and Intone was essentially designed for that patient population in mind. Secondarily, it's not just vaginal deliveries where women will be incontinent. About 20% of even C-sections, C-section patients actually are incontinent after delivery as well. So you could utilize Intone in that case as well.
Wow. All very interesting information.
Sure.
So away from the clinical for a moment and into kind of the brass tacks, if you will. What about insurance? With new devices coming out all the time, and how are women going to pay for this device?
Yeah, absolutely.
So moving away from the clinical, let's talk a little bit about the cost. Is there insurance coverage? Is this costing women a fortune? Talk to us a little bit about that.
Sure. Well, Intone is $595 and comes with a 100% money-back guarantee.
Wow.
Yeah, which
Not
is
bad at all.
It's amazing. And I guess when you consider all of the different incontinence therapy options out there, when you kind of look at a cost analysis, what patients typically find is that Intone is the most cost-effective option out there for treatment of their incontinence. And we can go down the list. Obviously, surgery can be very expensive. The cost of a medication taken every single day for the rest of your life is very expensive. And certainly, obviously, other therapies and other surgical therapies can result in many complications that can create additional costs for the rest of your life. As far as the insurance coverage is concerned, with regards to Intone, it is a covered benefit by Medicare, which is great.
Wow.
Medicaid typically follows suit depending on, it's a state-by-state basis. And then many private payers have actually already started to cover at least a portion of the Intone, and we're hopeful that many more will in the future.
You mentioned a money-back guarantee. That's a little unusual.
Yeah, actually, it's the only continence therapy that I am aware of that actually is guaranteed to work or your money back.
Wow. Wow. And how do you track that?
Well, again, we talked about this a little earlier, but this device records everything that the patient does. So as long as they're utilizing the device, we know that it works. If the patient discontinues use, then obviously it's not going to work. So that's how we can offer a money-back guarantee, because we know if they use it, it works, and this records everything that they do, so we can keep track of that.
That's great. Well, you've been extremely thorough. I can't really think of anything else. Is there anything else that you can think of to share with us that we ought to know about this?
Well, as Intone is a new device, what I would recommend is that you go over to your local obstetrics and gynecology, your urology or your urogynecology office and speak with your physician in regards to this. Then your physician can actually contact SurgeryPRO, and they can just go to www.surgerypro.com, and they can get the Intone unit through SurgeryPRO. And the wonderful thing about SurgeryPRO is that they will actually research and take care of all the billing for the patient, make them aware of their insurance coverage, and provide them with some flexible options for payment if it's not covered. And all of that comes with the money-back guarantee for the patient, so it's really risk-free. The patient can obviously utilize the device, take care of their incontinence symptoms, and it's all very easy to use, and it's a very easy process, and it's just a wonderful product.
Well, this sounds incredibly promising. It sounds like an exciting device and something that finally might be an option for women that are suffering from a very embarrassing and difficult problem. So thank you for spending the time with us today to explain all of this. We appreciate you coming by.
Thank you for having me.
Thanks for being with us for the interview with Chris today. That was very informative information. If you'd like additional information, please visit us at SurgeryPRO.com or email us at info@SurgeryPRO.com. You can also give us a call at 203-204-2874. Thanks so much. Incredibly promising, I believe, that you slob.
As I spill coffee all over the place.
Oh, God, don't make me laugh. Again?
Sorry,
Okay.
I ruined your couch, Marcus. I hope this is not Italian leather.
There you go.
It's IKEA leather.
Oh, there you go.
Okay.
There you go.
With the wonderful Chris Huffnagel, and here's the.
I'm not saying the wonderful Chris Huffnagel.
Got it.
You can say the wonderful Intone with that SOB. Chris.
Crap. I'm not going to be able to do this. So, what about?
You're going to have a little OAB going on here
I know,
pretty
really.
soon.
Okay, so let me rephrase that without the brass tacks.
Let's get down to brass tacks. What is
And I
Intone?
hadn't even had anything
What
to
does
drink yet.
Intone cost?